So we'd like to welcome you all joining us in our celebration of our first year. So we'll start out with just making a toast because it's been an amazing first year, and we thank everybody for all their support and this great team that we have here. So cheers and welcome. We thought it'd be fun to look back on what this first year has been for all of us. We have, of course, an agenda for this evening, and we're going to start by letting you know who we all are, for those of you who don't know us, what our roles are and how we all participate in this practice. Then we thought we'd review what our most popular services have been over the last year. We have an announcement about a group that we've been supporting called I Support the Girls, and we'll explain what that is and a special announcement about that shortly. And there'll be a giveaway around that topic. And then we'll go on with what our staff picks are, so our favorite products, the favorite products that we like to use, and the favorite services that we like to get here at the office. Then I'll just talk about a little bit about what this year has been like, and there's a second giveaway. And then, as always, we're open to questions. And Ashley's manning the computer here, so she'll be able to let us know if there's a question that pops up, and if it's an appropriate time, we'll definitely address them as they come, or certainly at the end we'll have some time to answer any questions that people may have. So welcome, and thank you again for supporting our practice. So those of you who don't know me, I have been in the state of Maine practicing plastic surgery since 2006. Before that, I was on faculty at Columbia University and relocated to Maine with my family, feeling that it was a kind of healthier lifestyle for my husband and I and for our children. And until a year ago, I was employed by a hospital and decided to open up my own practice in order to be able to provide the service that I felt like I wasn't able to do in a hospital setting. And I'll let you know all these people that I'm lucky enough to have had join me in this endeavor. And I'll start with Sarah Cheatham. She's a registered medical assistant who I was lucky enough to work with at CMMC, which is where I was employed before this. She's also a pool sculpting specialist. She also does a lot of other things. She's a surgery scheduler and gets things pre-approved by insurance companies and a little bit of everything. So she's definitely a valuable part of our team, and loves to be in the clinical realm and dealing with patients. And she has a smiling face to everyone who comes in here. Then we have two licensed estheticians. Katie has been with us since before we opened, even probably about a month before we opened. So when we started looking at technology and training, she's really been here from the beginning. She's also been an esthetician for 16 years and has worked in all sorts of areas in the beauty industry. So I think of her as the stylist in our office. She's always the best dressed and has ideas about all those kinds of things. So she has been a definite asset in helping build the practice. Kate Connor is also a licensed esthetician. She's the only one who's not here this evening. Unfortunately, she couldn't make it. She's also a pool sculpting specialist, has over 13 years of experience. And she also loves interacting with patients and really enjoys her role as an esthetician. Yep. Ashley's going to drive for a minute here. Okay, good. On our administrative team, of course, we have Ashley, who, when I first read this, Ashley's the one who puts together all these slides for these presentations that we do, and I was like, oh my gosh, we've known each other for 8 years, which seems crazy. I think when I first met you, you were either just married or just about to be married, and since then,
fresh out of my honeymoon.
Right, fresh out for your honeymoon for your job with us, and then now this is our third or fourth location together, and a couple of kids later, and a lot of good experience in what plastic surgery is in general, and also for me personally. So she keeps me in line and makes sure that we keep moving things forward. And then we were lucky enough to nab Allison. She is our medical receptionist, and she has a long history of customer service, and lucky for us, an incredible experience with the dermatology practice before us. So we've already learned a lot from her about medical practices, which has been great. And everybody on this team will just make you feel like you're confident and in good hands as soon as you walk into this place. And in a year, I can tell you that everyone here, I mean, I count on all of you every single day, and it's just been an incredible experience every day. I know that you're all incredibly professional and well-meaning and responsible, and I couldn't imagine a better group of people to work with. So this is the team. This is the team. So what has been the most popular thing in this practice since we opened? Like, surprise, I think definitely to me, but I think also to you, Ashley, is cool sculpting. And a little over a year ago, when we were trying to figure out what to add to the practice, I will tell you that it was the rep for the cool sculpting company that was just relentless. And he kept saying, you have to have this in your practice. And I was like, we don't really need it. We do surgery, we can do abdominoplasties, we can do liposuction, we can use Kybella. There's a solution for a lot of what cool sculpting can do. And he really was. I don't know. It was really good. It was really good. And then I was like, I can write you a recommendation if you ever need a job. Because I didn't want to buy this machine, and I ended up buying 2 of them. So he, I guess we should call him and thank him. It's been really good for this practice. It's such a nice adjunct to all the things that we do, because not everybody, A, is a surgical candidate, and not everybody, B, has the time to have surgery. And not everybody wants an incision or a scar on their body. It's a treatment that works really well, and it does one thing, but it does that one thing, it does it really well. All of us in the practice have had it, and are happy to show you our pictures. And it's definitely been I'd say the biggest surprise to me that's one of our most popular things. Injectables have remained popular in my practice, since 2006. It's kind of been a transition from various injectables. They change over time as the companies reformulate and try to make advances in the products, but still very popular. Neuromodulators, we offer Botox and Xeomin. Fillers, mostly hyaluronic acids, including Voluma, Volbella, Velour, Juvederm. Kybella is a non-invasive treatment for helping dissolve fat. It was FDA approved for the submental area right under the chin here. And Radius, which is it's a different type of filler. It's calcium hydroxyapatite. It's used in the face, but they also have FDA approval for the dorsum of the hands. The hands is a place that often shows a sign of aging, because people are more likely to take care of their faces, put sunscreen on. And it's only recently that people started paying attention to the aging of the hands. So injectables have remained popular in the practice. Laser treatments, we have the XLV by Cutera. It's great for vascular lesions, facial pigmentation, and then Genesis is one of the favorite treatments of everybody in here who's ever had it. It's good for almost everything. It's good for collagen regeneration. It helps with redness. It's good for bacteria treatment for people who have acne. And it feels good to get it. You just walk out with a healthy glow. There's no downtime. And it's a nice rejuvenating quick treatment. From a surgical standpoint, our most common surgical procedure is tummy tuck or abdominoplasty. I think our last webinar was the abdominoplasty webinar, and it still, over the last 15 years, has always been my favorite procedure. It still is. I did one today, and every day that I do an abdominoplasty is a great day. People feel really good almost immediately after, despite the post-operative pain. It's such a dramatic change in contour and in function, and so yeah, lucky for me that it's one of our top surgical procedures. So that's what we've been doing this last year. And so we'll start with the cool sculpting and what makes it so popular. And Katie's going to talk about it a little bit. She's kind of taken the lead on, I think, embracing and loving the procedure as much as anyone ever could. And so she just by nature has ended up doing more than any of us. But it's a treatment that's FDA approved to clear fat cells, and it's safe. It's able to be used all over the body, and it's great for targeting areas that are resistant. And I'll tell you from being in a consultation with Katie that she sees things that I didn't see on myself that I'm really happy that are now taken care of. So I appreciate your expertise and being able to know where it could be used best. So you'll tell us a little bit about why you think patients love it so much.
People love cool sculpting for exactly those stubborn areas. It really helps to sculpt the body. There is no downtime. They can go back to doing whatever they were doing whenever they leave here. It's sort of forced relaxation. So we put pillows all around you. We put a blanket on you. You can read a book, do work, watch Netflix. If people are here for a long time, we get them snacks and lunch. So it's not too terrible at all. Everyone has definitely seen some great results. People are finding their clothes are fitting better, or just areas that have always bothered them that they can't fix at the gym are diminishing. It's just great. It's nice to see when people come back. At 7 weeks, we do follow-up photos, and the amount of smoothing people are experiencing is fantastic. And just people's overall satisfaction and smile on their face when they see the results is exciting. It makes me feel good that they've gotten a treatment that they're happy with, and they're happy.
Yeah.
It's nice.
Yeah, happy patients make it easy to love it.
It's addictive. That's probably the only bad thing about it.
Right. The more you get, the more you want. Anyone else want to add anything about cool sculpting?
No, I can just speak my personal experience that actually the outfit I'm having tonight usually is pretty uncomfortable to wear, and tonight looks as comfortable. So it's great.
Pull out some of those old clothes you haven't worn in a while.
Yes.
My white jeans I never wore because I could see bulges on the side. Those are gone. So it's really, we've all had it. We've all seen results.
Yeah.
Lots of happy.
Right. And Katie really pampers you.
Right.
Very well taken care of. You'll enjoy it.
That's the best part.
Good. Okay. Then just a little bit about I Support the Girls. When we started this business a little over a year ago, we were trying to figure out ways that we could get back to the community. And mostly by chance, in the car, I heard something on NPR about this group called I Support the Girls. And specifically, it's for women that are homeless. And the goal is to provide them with brassieres and products for feminine hygiene, so tampons and pads. And when I first heard this conversation on the radio, I was thinking, gosh, people are really happy to donate food and clothes and coat drives and all these things that I think most of us have, certainly I have been aware of for a long time, the ways that you can help out, but it hadn't ever occurred to me how difficult it may be for some women to obtain bras and hygiene products. I was aware that in third world countries that's one of the problems with educating young women is that when they have their period, they don't have any products to take care of it, and so they miss days of school, they miss work. If you don't have the finances or a way to take care of these what seems simple to all of us that just manage this on a regular basis. And specifically the homeless population, that it's a way to just give someone a little extra dignity that this is one thing that they don't have to worry about. And I think certainly I haven't ever thought about the need for bras and hygiene products. And the federal government programs that offer aid, such as WIC and money for food support and things like that, have never considered this to be, a primary need for women. So as I was hearing about this, I thought, oh my gosh, this is the perfect thing for us. I mean, all of us, everybody has bras that you either purchased at the wrong size, or you thought it was going to fit differently, or didn't work, and they're sitting in your drawer. You're not wearing them. They look nice, and someone else could really benefit from them. And so we do collect them here in the office, and Ashley's now become the liaison for the whole company in the state of Maine. We've collected
Hundreds
of bras,
which is really great. So I think it was a natural fit for our practice because we see a lot of women clientele. And I mean, I know when we started this, I was like telling my mom about it, and I went to lunch with her, and then, and she brought me a huge bag of bras. Because I think we all have so many in our closet, and we don't realize it until we, actually
start looking at it.
Yeah. So it was actually pretty easy to get people to donate because it's something that a lot of people have hanging around. And, we have events here in the office, and we always open it up for donations there. So the community has been really great with donating. We've had patients ship us bras, which is really great. We went to the Women's Expo, and there were like Girl Scouts bringing us bras, and it was really great. So it's a really great feel-good project that we do here, and the whole team gets involved. Katie and Allison just went to Preble Street Homeless Shelter the other day and made a big donation, so we have a great relationship with them there, which is really nice. So it's just a great program, and the really exciting part is we are going to be accepting a huge donation in I Support the Girls' name. So basically, I Support the Girls across the nation works with these big companies such as Lola. We just did a Soma drive as well. So Soma bras in the main mall, we went and picked up a big box from them because they did a drive for I Support the Girls. And so Lola is donating Maine 62,000 pads and tampons, which is incredibly exciting. And we get to distribute them as we see fit. So, we're going to work with Preble Street and a couple other shelters in Maine. It's going to make a huge difference for such a small population in Maine. It's going to go a very long way. So we're very excited.
I think when Ashley emailed all of us, and I wrote back and I was like, I think you mean 6,000.
Yeah.
She was like, no, 62,000.
Yeah, I had to pull over in my car and text everybody, so I was so excited. So now we're all trying to figure out, what is 62,000?
What does that look like?
And we're basically going to make a whole day of donating them, which is going to be really fun. So we are the Maine affiliate, so we help other people across the state to organize drives. So initially when we started with I Support the Girls, we were like, we want to do a drive, and we hosted a drive and did really well. We were really excited about it, and Rachel at I Support the Girls said, hey, do you want to be the affiliate for Maine? Because nobody in Maine was doing it, and we took on that task and haven't turned back. So it's been really great.
Right. It's fun to have a project that everyone's happy to participate in. And
so we're just hoping to spread awareness and continue, getting donations across the state, and we're happy to help in any way possible if those happen. So
great.
So watch out for our big donation day, and we're gonna find a van and we're gonna make it happen.
Right.
So on that same slide, this brings us into our first giveaway. So we want to know what you think, how many boxes you think 62,000 pads and tampons will be in, because we have no idea. And we're trying to figure out how full Dr. Holland's garage is going to be. And so we would love for you to take a guess. You can just type your answer in the questions box. It's all private, where you can email us. You can, there's a survey after the webinar. You can put your answer in there, and whoever comes closest will win a customized facial by Kate Here Kate, and an HA5 hydrator by Schematic, which is an amazing giveaway. So it's very exciting, and we'll announce it after we actually get to the delivery, which is in the next 2 weeks. They will be coming. So take a gander, because we are very curious.
It's hard to imagine.
Yes.
All right.
I see some votes coming in, which is great.
Oh, good. So people are guessing. Excellent.
Yes.
There's participation. Okay, so staff picks. What are our favorite products and services? And what I love is that we all have a different favorite. And I think that's because we're all like a little bit different ages, kind of different skin types, things like that. So there is something for everybody. For me, the thing that kind of was a new find for me personally was this company called Environ, that really is based all around vitamin A and skin health. The person who designed it was mostly focused on skin cancer prevention and improving skin health. So the Environ Body Kit was exciting to me because we have all sorts of products that we know are clinically proven to work on the face, but really there hasn't been anything good for the body. Yes, we can use sunscreens, and certainly protection has been key. There's some body exfoliation products, and really that's about it. This is a combination set of products. One is called Dermalac, and that's an exfoliating liquid. It has a little bit of an acid in it that helps keep the skin soft. And then the smaller one that you see in that picture is the vitamin A, also with C and E, which are good antioxidants. We know that skin health really is improved dramatically when people are on retinols and other forms of vitamin A, as the vitamin A's can actually get into the skin cells and help repair your skin cells. And I have very fair skin and a lot of sun damage and have had multiple skin cancers on my face and on my arms. And this is really the first kind of delivery system for vitamin A into the body. It's a nice oil. They're both oils. You can either apply the exfoliating Dermalac first and then the vitamin A oil second, or you can actually mix them together and apply them both. And kind of depending upon the time of year or what my skin's doing, I decide how much of the Dermalac and how much of the vitamin A. But it's dramatically improved kind of the quality and texture of my skin. I have a lot of actinic keratoses and surface stuff, and it really has made a big difference smoothing those things out. And I feel like my skin in the long run is going to be healthier. Hopefully I'll have fewer skin cancers, maybe not 5 years from now, but 10 years from now that I'm treating my whole body with the vitamin A. So I think that it's really easy to use. It feels good on your skin. Is anyone else using it? But no, it's different than a cream. Like a cream, I feel like you kind of get a little tacky, and you can always feel it. My skin, you don't feel that you have anything on it. It just feels soft and well moisturized and really comfortable. So this was the product that led us to bring on more products from the Environ system. So I love these two specifically. And then the back treatment, which was designed by Katie, and is far and away my favorite treatment. We were just talking earlier that I need to get on her schedule. Like I just talked about this nice body product, but I can't reach my back to put these products on. Every once in a while, I can get one of my family members to help a girl out, but it's not like a regular, everyday thing. So a back treatment, it starts with microdermabrasion, and I'm not going to tell you the right order perfectly, but it's
a facial for your back.
Basically a facial for your back. So you get the cleanse and the hot towels and the microdermabrasion, and then a mask, just like you would have on your face. It helps exfoliate. It just makes the skin back there feel so good. And if you have any blemishes or things that you might not know about, Katie will definitely find them and take care of them while she's there. There's also a massage involved, which I'm sure is partly why I love it so much. But it really makes your skin feel amazing, like this one area that you really can't treat yourself. So that's my far and away my favorite treatment that we offer here. So, and who is next? Oh, Kate's not here, but we all want to tell you that Kate loves TNS. It's a growth factor product that has been around actually for a while, but they're one of the first companies to show clinical data on growth factors. And they have stabilized their serum so that it can penetrate the skin, and also that it keeps the quality of the product, how they package it and process it. And Kate always says that the TNS is a green smoothie for your face. And it's good for rejuvenation, it's good for wound healing. We use it in people who've had certain laser treatments and peels. It can be helpful in helping the skin heal. And then the laser genesis we alluded to earlier, it's a 1064 YAG laser. It penetrates the skin, and it delivers actually thousands of pulses over a relatively short period of time. And what it feels like to me is that someone's kind of throwing hot sand on your face in a really nice way. It's just pleasant, it's warm, there's nothing painful about it. And it's great for collagen regeneration, for decreasing redness. It's great for acne. It decreases the bacterial load with the heat that it's delivering to the skin. Nice for fine lines, tone, and texture. And there's really almost everyone could benefit from a laser genesis treatment. I think I've been getting them once a week for the last 5 or 6 weeks, and it just really makes a nice difference in the tone and texture and redness of the skin. So those are Kate's favorites, and Ashley has the mouse. Let's go to the next slide.
Sorry.
And next is Sarah.
Okay, so my favorite product is the Skin Medica Total Defense and Repair SPF. As these ladies can attest, I don't like doing anything on my face unless it's really simple and direct. And I like this product because it's so many different things in one. If I was to only put one thing on my face, this would be it. This is the one thing I make sure I put on every day. It helps moisturize, it helps improve the texture of your skin. I just like how it feels. My skin feels a lot smoother now. And then most importantly, it has an SPF, which just helps prevent all the things that we don't want to happen. So I love this product. And then the service, which I'm really excited about, is the Kybella, which I had done back in April. So it's an injection that goes in the submental area. So I had a couple syringes done. So it was a lot of little injections. It can be a little intense right afterwards. And like a lot of things that we offer, some things get worse before they get better. You don't have this swollen, but now I've lost a lot of the fullness in that area. I had a lot of people ask me if I've lost weight just because I've lost some of the fullness here. It makes it a lot easier in this day of social media to take a selfie and not have to worry about what angle that you're at. But no, I highly recommend this product. I love it.
Yeah, and the TDNR, it's a great sunscreen. It's easy to wear. You don't see it or feel it on your skin. It comes both tinted and untinted. Do you like that?
I like the untinted
yeah.
because then I have the option.
It's comfortable, and then the fact that you're protecting the skin and preventing any further damage. It also has the antioxidants. So just like Sarah said, it's a treatment product and a sunscreen all at the same time. So it's kind of the one. But anyone who's been in here knows that we don't want you walking out of here not using a sunscreen. Like if you're going to do one thing to change your skincare regimen, it's making sure that you have a good sunscreen on every day. So this is kind of the starting point for a lot of our patients.
I always tell Katie I tease her because I always feel like I'm at the dentist office because I always hear her with our patients. They come out, they're like, she's like, are you using your sunscreen? Are you using your sunscreen? It's kind of like, are you flossing? Are you flossing? Are you flossing? You know, so I always tease her on that one, but it's very true. Everybody leaves with a sunscreen.
Right.
Thanks, Katie.
Yeah.
And it goes on really nice. It's nice and creamy. It just feels good.
Yeah, it doesn't feel like like the sunscreen that you had on you when you were a kid. Just feels like a nice moisturizing cream. All right, who's next? Katie.
All right, my favorite product is the Environ EVST moisturizer. I really like the whole Environ line. I have noticed a huge difference in my skin since I've been using it. But EVST was the first product I started with, and I think everyone should be on it. It's a great step-up system, so no matter where you have been in your regimen, if you've never used any products or you've used retinols in the past, we can start you on a level that will suit your skin, and then we continue to build you up. So you're not going to have any irritation with the product. You get a little bit of moisturizer from it, as well as your vitamin A. I've noticed a lot of change in my texture and just overall brightness from using it. It lasts a long time, 1 pump in the morning, 1 pump at night, and you're good to go. My favorite service, of course, is consulting. Again, I know personally I've been happy with my results, and again, I'm just so happy to see clients being as happy with their before and after photos and feeling better. So I like that it's non-invasive, and so many people who thought that they might have not been able to have surgery for whatever reason are able to chase those areas that bother them with the cool sculpting. In addition to cool sculpting, I have a new favorite service, which is brand new for us. We just went to training yesterday. We will now be offering lash lifting, which we had yesterday. Lash lifting is about a 45-minute service. It's going to give you some length just from the treatment. It's basically, for lack of a better way of saying it, perming your lash. So we use a little rod and we wrap the lash around it. It is not painful at all. You lay down nice and comfortable with your eyes closed. When you wake up, you have luscious lashes. They last for about 6 to 12 weeks, depending on how well you care for them and how coarse your lashes are. But it's a really nice service. We can do tinting on top of it, so it darkens them a little bit. It's great for if you're going on vacation or if you just really like a low maintenance makeup routine. Even Ashley loves a good full lash, so both she and I did some mascara over our lift, and we're blown away by the results. So it's a great little add-on service.
That's great for the summer, because you don't have to wear makeup in the
Yes.
summer.
Right, we were already addicted to the lash tinting, so this is even better.
Right.
Also, I just want to say about the pool sculpting, when you were saying how happy people are when they come back. It's often, we've found also that people have started to be able to lose weight that they weren't able to lose before. I think just a little motivation, like you see something that's looking better and you're like, okay, I'm gonna do this. Like, I think it sometimes provides like that little extra, if you feel better about the one area that was really bothering you, it kind of can lead to some significant improvements in habits. So that we've seen as well. Ashley.
Okay. So my favorite product is Skin Medica's HA5 Hydrator, which is hyaluronic acid. And basically our body makes that naturally, but over time, like everything else, it diminishes. So adding this to your regimen really, will help bring it back and keep it there. And basically it's just a great light hydrator. It also fills and plumps. So it will fill some of those fine lines and wrinkles. And then it also smooths them out, which is great. But for me personally, I've always had combination skin, so I've never been able to use a hydrator. They were always too heavy for me. But then at the same time, which sounds crazy, my skin was always dry. Like it felt like it needed hydration. So this does that for me without, leaving me slick and, oily by the end of the day. And I also have that plumping in combination, which is great. And then for my service is lip filler, which is actually a shocker for me because I've been with Dr. Holland for a very long time, and I was like, I'll never have lip filler. Like my lips were always, pretty plump already. But now that I've tried it about, I would say maybe 2 years ago, and I've been getting them done ever since. I just love, the way they look and the way you're, and I love a good lip color, and it really helps with that part of your, makeup routine in the morning. So those are my faves. So the exciting part is first being part of our webinar tonight. If you are watching with us right now, you'll receive 50% off all of our favorite products and $50 off all of our favorite treatments. And those are good until the end of August. So once again, you must be present on the webinar, watching with us live, and come on in and have some of these great treatments done and snag up some of these great products. All right, back to Dr. Holland.
Yeah, I mean, just a little recap. You can see how engaged everybody is in the things that they're using and liking. It's nice that we've all had the opportunity to try all these things. You can see how well educated everybody is about what we're offering and what we're providing. And really, I couldn't ask for a better team. And when I say that I wouldn't have ever dreamed that we'd be here in a year, I thought we would be kind of where we are today in maybe 2 or 3 years from starting the practice. But I think it's a testament to how comfortable everyone on this team makes people feel when they walk in the door. And this is something that I hear from patients every day at the end of an appointment. They'll compliment me on Allison or on Sarah or on Katie or on Ashley or on Kate, and it's constant. I mean, like every day, not a day goes by that someone doesn't say, wow, your staff is amazing. And even my father has been a physician in New York City forever, and he's in the process of thinking about retiring. And he was in here the other day, and he came into my office and he closed the door and he's like, you have the most incredible staff. Like, do you know how lucky you are? And I was like, I do. Like, I really it was nice to hear from him that like he can see what I can see. And I know that makes a huge difference. And that all of you are a lot of why people love to come here and love to be taken care of here. So I'm so grateful for all the people I'm working with, for all the support of our patients and the local medical community and everyone who's led us to have such a wonderful first year. And we really are excited and looking forward to just, continuing to grow and provide service and be here for education and support when you need it. So thanks for a great first year.
Yeah.
It's been a lot of fun.
Yes, lots of.
Ooh, giveaway number 2.
Okay, so just for joining us tonight, so thank you for joining us. You will be put into a raffle to win Katie's famous back treatment and the Environ body kit that Dr. Holland loves so much. So that's a great giveaway. And just for watching with us tonight, you'll be put in and we will contact you. We'll pull that out tomorrow.
Great. Are there any questions? Anyone want to know anything specific? Any questions for any of us about any of our products or our procedures or topics that we haven't addressed? I'm just going to check out the questions. It's super fun sharing the camera with everybody.
Yes.
I feel a little bit alone.
Strength in numbers.
Right? Right? Anything coming up?
A lot of good guesses on the boxes.
Oh, good. Yeah,
All right,
good.
nice.
I can't even imagine what 62,000 would look like.
No.
The
I
number of
wasn't
people.
surprised.
Yeah.
I think like 4. I don't know.
No way.
No.
4? I mean, if they're loose.
Like big cardboard box.
Mm-hmm.
Yeah, I don't know, how are they gonna come in?
See, that's why they
Trash
can be
bag, that's a good
separated.
Right? Good question.
Like, I feel like it could be 60 boxes.
Yeah. that's-
No.
A 1,000?
Like 1,000 in a box,
1,000 in
that
a
would be
box? That
60.
seems like a lot. Well, we'll see. We'll keep you posted when we get them.
Oh, very
We'll take some
curious.
pictures. Get the count.
I'll have our own guesses, I think.
And as always, if you have any questions, you can always call us or email us at info@hollandplasticsurgery.com. Our phone number is 207-835-4777. Now it's like an infomercial. So if there's anything you're just dying to know, just give us a call. And we look forward to your next visit at Holland Plastic Surgery. Thanks for joining us and thanks for your support this year.
Yes, thank you. Happy 1 year.
Happy 1 year.
Yay.
Cheers. 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 Thank you.